Welcome to Westgate Resort's open enrollment for the 2023-2024 plan year. Westgate Resorts is committed to offering quality plans and a well-rounded benefits package to their team members now and in the future. Please review all the benefits Westgate Resorts offers you and select the plans that work best for you and your family. If you have any questions, please email them to benefits@wgresorts.com or contact your local team member services. So, let's get started. During this presentation, we will provide an overview of the benefits offered. We'll discuss our new partner, Quantum Health. We'll learn about the wellness program requirements. We'll review in further detail the specific benefits offered. We'll look at how to enroll online with PlanSource, and important other next steps. Westgate Resorts is partnering with Quantum Health to provide you and your families with a simplified experience that lessens the stress, uncertainty, and expense associated with a healthcare journey. You will now have access to a dedicated team of claims experts, customer experience professionals, and nurses to help you. So when you don't know where to begin, start with Quantum Health. They can help with simple things like replacing ID cards, or more complex matters like claim resolution or helping you manage a chronic condition. On this slide is the Quantum Health phone number and website. Anytime you or your family has a benefits question or concern regarding medical or pharmacy, you will be contacting Quantum Care coordinators. This information will be on your ID cards. Their phone lines and website will open for you starting June 1st, 2023. Beyond ID cards and verifying coverage, Quantum can help provide educational resources, advocate for your care, help to manage any chronic conditions, assist with avoiding unnecessary out-of-pocket costs, and so much more. One thing that sets them apart is that they will engage with your providers to check network status, discuss claims, and ensure proper authorizations for upcoming procedures you may be having. Please always reach out to Quantum and let them try to take things off your plate. They are there to take your calls and inquiries, but there are instances when MyQ healthcare coordinators might call you. Some of these reasons include your provider is out of network, a nurse support for condition management, pre-admission or post-discharge support follow-ups, general follow-up on a claim or issue inquiries. So please pick up. They'll always leave a message so that you'll know it's them. Here's what the member website, mywestgatebenefits.com, and mobile app will look like. The app offers the same functionality as the website, including the ability to download a copy of your ID card so you'll always have it. This is available from the App Store or Google Play. Just search MyQ Health or scan the QR code shown here. Here's another view when accessing the mywestgatebenefits.com member website. Again, the MyQ Health app offers the same functionality as the website. After you complete your registration and log in, you will see that there are a variety of ways that you can connect with your care coordinators. While they prefer to talk with you, we know that may not always fit your busy schedule. Whether you are on the website or the app, you can take advantage of their live chat functionality. Schedule a call with a care coordinator at a time that works best for you, or send them a secured message. This year's open enrollment period will be from Monday, May 1st through Thursday, May 11th. Online enrollment is done through benefits.plansource.com. All team members are requested to access this system. Your elections will become effective June 1st, 2023, and will remain in effect until May 31st, 2024, unless you experience a qualified life event. such as marriage, birth of a child, etc. If you experience a qualified life event during the year, you must notify TMS within 30 days from the date of the event, and you must log into PlanSource to change your benefits. Otherwise, you will be unable to make a change to your benefits until the next open enrollment period. New full-time team members will be able to enroll in benefits after they receive their first paycheck. Benefits will become effective on the first day of the month following 60 days of service. There is a spousal surcharge if a covered spouse can purchase medical insurance from their employer. A surcharge will be added to your premium. You must log into PlanSource to answer the question about your spouse's alternative medical insurance coverage each year, or when there is a change. The deductible and out-of-pocket maximums are on a plan year. Here is a comprehensive list of benefits offered to Westgate Resorts team members. Any members wishing to add new dependents to coverage will be required to submit appropriate documentation. Coverage will pend until documentation is submitted and approved. Premium changes will take place the first of the following month after documentation is approved. Childbirth is the exception. The qualifying event date must be date of birth. You must submit documentation into the My Documents section of PlanSource within 30 days of the insurance effective date. Below are acceptable forms of dependent documentation. For a spouse, a marriage certificate. For children, birth certificates or adoption certificates, up to age 26. Coverage does end at the end of the calendar year the dependent turns 26. Upon completing your enrollment in any benefits requiring dependent verification, you will receive an alert stating that your benefits are pending approval. You will see a to-do list, which will indicate which documents are being requested. For any additional questions, please reach out to Team Member Services. Westgate Wellness is committed to helping you achieve your best health. Our voluntary wellness program provides personalized awareness, education, and coaching to all participants, team members, and covered spouses on our group medical plans. We also offer lower premiums and cash incentives for team members and their covered spouses for managing their health. To participate in Westgate Wellness, team members and their covered spouses must do or have done the following. Take the clinical health risk assessment by the due date. Complete the biometric screenings by the deadline. Take and pass the nicotine test during the biometric screening. Be tobacco or nicotine free for at least 6 months. Team members and their covered spouses who do not meet all of the above requirements will be assessed the higher non-wellness premiums beginning at the start of the plan year. Westgate Resorts provides wellness participation incentives as shown in the chart below. Earn cash by achieving biometric screening targets including BMI, blood pressure, LDL and HDL cholesterol, fasting blood sugar, triglycerides, and for getting an annual physical exam. The biometric incentives are based on the results of your completed biometric screening. Incentives are available for the team member and the covered spouse. If you think you might be unable to meet a standard for a reward under this wellness program, you might qualify for an opportunity to earn the same reward by different means. Contact UMR at 800-207-7680. HealthScope members call 844-604-6245 to engage with a health coach, and they will work with you, and if you wish, your doctor, to find a wellness program with the same reward that is right for you in light of your health status. Cash incentives will be processed through payroll on a semi-annual basis this year. Please allow 6 to 8 weeks after the completion of your annual physical to allow verification from UMR for processing. The payout dates are listed here. If you elect medical coverage, you will be asked to complete the tobacco affidavit question during your online enrollment each year. The minimum plan provides access to healthcare facilities and providers in the UMR Choice network. It is available to all team members and will offer the lowest premiums and per pay period deductions of all the medical plans offered. When electing this plan, be sure you are aware of the deductible of $1,500 per individual and $3,000 per family, which will need to be met prior to UMR paying any portion of your eligible services. After you have met your deductible, you will be responsible for 30% of eligible charges up to your total out-of-pocket maximum of $4,000 per individual and $8,000 per family. Once you have met your total out-of-pocket maximum, UMR will pay eligible charges at 100%. You will also be eligible to open a health savings account, which we will discuss in further detail on the next slide. All medical plans offer preventative care coverage at 100%. Preventative care services are things such as annual physicals, well woman annual exams, mammograms, immunizations, colorectal cancer screenings, and well child care. A general medicine teledoc virtual visit copay will not exceed $45 at the time of the call. A dermatology teledoc virtual visit copay will not exceed $75 at the time of the call. Members on all medical plans using specialty medications will go through the Maxer Plus Specialty Pharmacy Program. Specialty medications are those that may require ongoing clinical oversight and education for best management. They may have their unique storage or shipping requirements, or may not be available at retail pharmacies. This program provides the resources and personalized, condition-specific support needed to help better manage the condition. So what exactly is a health savings account? An HSA is a special type of bank account designed to help you save and pay for qualified medical expenses. In simple terms, it's like an IRA for your health. But with an HSA, you don't have to wait for retirement to spend the money. You can use it this year, next year, or years from now. An HSA works like this. First, you open an account and deposit money into it, income tax free. The funds in the HSA belong to you. You own the account from the day you open it. There's no use it or lose it rule like there is with a flexible spending account or FSA. The account is with you as long as you want it to be, even if you change jobs, lose your job, or choose a different health plan. You save money on taxes. The money you put into an HSA is tax deductible. You don't have to pay federal income tax on HSA contributions or state taxes in most states. And any money you take out to pay for qualified medical expenses is income tax free too. You can use your HSA to pay for qualified healthcare expenses for you and your family now and into the future. The health savings account plan can be broken down into two parts: the high deductible medical insurance and the savings account. The high deductible insurance will act as any of the medical insurance plan would, protecting you from medical bills through preventive services, deductibles, co-insurance, and out-of-pocket maximums. The savings account will allow you to pay for your deductible and any other eligible expenses, with pre-tax dollars deducted from your paycheck. It will also serve as a tax-deferred savings account. This slide gives you an example of the savings when you contribute to an HSA. What you contribute affects the amount of savings you will see. You own the HSA account, and the contributions made this year can be used next year or years from now. You don't ever lose your HSA contributions. You are offered 3 healthcare accounts: a health savings account or HSA, an FSA medical spending account, and a dependent care account. Your choice between the medical insurance options drives your eligibility for each account. To be eligible for the HSA, you must be enrolled in the minimum HDHP plan. To be eligible for the FSA or DCFSA, you may be enrolled in the minimum, if not enrolled in an HSA, base, HPP, PPO, and HSP plan. For all 3 plans, the funds can be used toward eligible healthcare expenses. A more expansive list of these expenses can be found in the Plan Source Documents Library or the IRS website. With the HSA, your funds will roll over from year to year, and the FSA and DCFSA, any unused funds, will be forfeited after the grace period. Please take a moment to fully review the chart to evaluate which account best fits your needs. You can access your HSA balance by logging in to the umr.com site or mywestgatebenefits.com. Select the Account Balances tab. View your HSA balance information. It also features a link to Optum Bank for full account capabilities to pay bills, make deposits, manage your investments, or view your transaction history. An HSA can also lead to savings on your tax return. Your health savings account is here to help you pay for qualified medical expenses, big or small. This includes anything from prescriptions to contact lenses. Reminder, you can do your HSA banking on your member website, umr.com or optumbank.com. Please refer to the next 2 slides for further details on the health savings account. If you are interested in an HSA, please read this slide for things to know about your HSA. Here's more details on what you need to know about an HSA. The base plan provides access to healthcare facilities and providers in the UMR Choice network. The base medical plan offers slightly better coverage than the minimum plan since you have copays for services without having to meet a deductible first. The copays are as listed. For primary care visits, $40, and specialist visits, $60. The base plan has the same deductible and out-of-pocket maximum as the minimum, but you will only need to meet the deductible when you receive inpatient or outpatient services. The deductible decreased this year to $1,000 for an individual or $2,000 for the family. And out-of-pocket maximums are now $4,500 for the individual and $9,000 for the family. But this still allows participants to save money on premiums. This type of plan is ideal for families who do not use their health insurance plan very often and want to have more control on how they spend money for health care. Urgent care facilities, walk-in retail clinics located inside your pharmacy, and your primary care doctor are far less costly than the ER and should be used for non-emergency treatments when possible. Top example of non-emergency diagnosis that could be treated at one of these facilities instead of the ER include urinary tract infections, headaches, lower back pain, dizziness, viral infections, bronchitis, knee pain, and diarrhea. Prescriptions will have a $300 deductible for individuals and $600 for family to be met first, and then copays will apply at $10, $50, $75 for a 30-day supply. Mail order is also available for prescriptions requiring more than a 90-day supply. Also, on all medical plans, members who purchase brand-name prescription drugs will pay a higher copay than they would for purchasing generic drugs, unless their doctor indicates that the prescription should be dispensed as written. Also remember, WG Meds, the voluntary program for certain brand name maintenance medications, has a $0 copay. The HPP plan provides access to healthcare facilities and providers in the UMR Choice Network. The HPP plan provides less out-of-pocket cost when you need services, but will cost more in premiums than the minimum and base plans. When visiting a PCP, you will have a $20 copay, specialist $40, urgent care $50, and $300 for emergency room. We will touch on urgent care versus emergency room further into the presentation. If, after you are seen by your PCP or specialist, and they determine that you need to have outpatient service or surgery, you will be responsible for the deductible of $300 for an individual, $600 for family, then 30%. If you are admitted to the hospital, you will also be responsible for the deductible and 30% up to a maximum of $3,500 for the individual and $7,000 for the family. Prescriptions are $15 for generic, $40 for brand name, $60 for non-preferred for a 30-day supply. Again, remember, WG Meds, the voluntary program for certain brand name maintenance medications at no cost to you, a $0 copay. The PPO plan provides access to healthcare facilities and providers in the UMR Choice Plus network. With the PPO plan, you have the flexibility of going in or out of network. In network, you will need to visit UMR participating physicians and hospitals. While going out of network, you can visit a physician or facility of your choice, but this will mean more out-of-pocket expense to you. In network, you will have copays for the following services: PCP, specialist, urgent care, and emergency room. If, after being seen by your PCP or specialist, and they determine that you need to have outpatient service or surgery, you will be responsible for the deductible of $500 for an individual, $1,000 for the family, then 20%. If you are admitted to the hospital, you will also be responsible for the deductible and 20% up to a maximum out-of-pocket. The in-network out-of-pocket maximum is $3,500 for the individual and $7,000 for the family. Your prescription copays for a 30-day supply under this plan are $15, $35, and $55. Mail order is also available. Going out of network, you will have a $1,000 individual, $2,000 family deductible, $40 of coinsurance, $6,000 for an individual, $12,000 for a family out-of-pocket maximum for all services. Again, remember, WG Meds, the voluntary program for certain brand name maintenance medications at no cost to you, a $0 copay. The HealthScope HSP plan provides less out-of-pocket cost when you visit an Imagine Health Network provider. When visiting an Imagine Health provider or specialist, you will have a $20 copay, specialist $40, urgent care $75, and $300 for the emergency room. We will touch on urgent care versus emergency room further into the presentation. If after you are seen by your Imagine Health provider or specialist, and they need to determine that you need to have outpatient service or surgery, you will be responsible for the deductible of $750 for an individual, $1,500 for a family, then 20%. If you are admitted to the hospital, you will also be responsible for the deductible and 20% up to a maximum of $3,500 for an individual and $7,000 for the family. If you decide to go to a non-Imagine Health provider, you will pay more out-of-pocket, as shown here under the Non-Imagine Facilities Network. You and your family will pay higher deductibles, out-of-pocket maximums, copays, and coinsurance. You could also be responsible for a balance bill from the provider of service. A general medicine teledoc virtual visit is a $10 copay at the time of the call. A dermatology teledoc virtual visit is a $30 copay at the time of the call. Maxor Plus will be your provider for prescriptions. $15 for generic, $40 for brand name, $60 for non-preferred for a 30-day supply. WG Meds is our voluntary program for certain brand name maintenance medications at no cost to you. This will be discussed further on the upcoming slides. The HSP plan is available to team members who live within Orange, Osceola, Seminole, Lake, or Polk counties. This medical option is an affordable plan with reduced premiums, lower deductibles, lower out-of-pocket maximums, and lower coinsurance compared to the base plan. This plan removes network constraints on some services, allowing you to freely choose healthcare providers and/or facilities while reducing the overall cost of your healthcare. The HSP plan provides access to healthcare facilities and providers in the Imagine Health Network, which is Orlando Health. Using an Imagine Health provider gives you the best price and benefit from your plan. Even so, you may still choose freely from all licensed providers and facilities in your area without a network penalty. When you see a non-Imagine Health provider, the plan's pricing is based on a percentage of Medicare's allowable amount for services, and you could be balance billed. You will also receive the benefit level as reflected on the benefit summary. Non-Imagine Health, which will be more out-of-pocket than if you see an Imagine Health provider. Please refer to the benefit summary on the next slide. The next few slides will help you understand the advantages of this new plan and how it works. Imagine Health has partnered with Orlando Health. Be sure to visit mywestgatebenefits.com to find an Imagine Health provider and receive the highest level of benefits with the HSP plan. If you currently see an Orlando Health provider, please be sure they know you are covered under a new plan. The HSP plan covers medical services for physicians and hospital facilities. You decide at the time of service if you want to receive the best coverage under this plan. Then you will want to make sure that you are seeing an Imagine Health provider. Your responsibility will be a lower cost share for the Imagine Health network of copays, deductibles shown on this summary, and you will not owe your provider anything more than what is shown here, and there is no balance billing for the service. However, if you decide to select any facility or provider, you will owe whatever deductible, coinsurance, or copays are due based on the non-Imagine network plan schedule for that particular service, and the price is based on a percentage of Medicare. You could owe more or be balance billed. The HSP plan is a new type of plan. It's possible that some providers may see your new ID card and tell you that they don't take your insurance. Occasionally, a provider may say you have to pay in full, up front, to receive services. Sometimes, after a provider receives the fair payment, the provider may bill you additional dollars above the reference-based price. When your claim is paid, your provider receives documentation of how the price was determined. Your provider may dispute the price. There might be possible roadblocks or service refusal by your provider. When seeing your healthcare provider, present your member ID card. Your ID card outlines what networks are used by your plan. It also gives the contact information for Quantum Health so that your provider may reach out to them with any questions. If your provider has concerns about how your plan works, please ask them to call Quantum Health at the number on your ID card. The customer service team can quickly explain the plan so that your provider feels confident about their upcoming reimbursement. You may also be connected to a care coordinator that can negotiate a price for services to ensure that your provider is satisfied with the reimbursement amount. Do not pay in full for services up front, except for perhaps your copay or a portion of your deductible if owed. Otherwise, your provider will be overpaid and you will have to collect any overpayments from the provider yourself. A balance bill may be sent to you or your covered dependents from the provider. So, what makes a balance bill different from any other bill you might get from your normal and cost share, such as copays, deductibles, or coinsurance, owed to the provider? A balance bill refers to any bill from the provider that asks you to pay for dollars that you do not owe, per plan provisions, as shown in the example. Please make sure to open your mail. If you receive a bill from a healthcare provider and it is for an amount beyond what you owe, contact Quantum Healthcare coordinators using the number on your ID card. Please have your balance bill with you when contacting your healthcare coordinator, as they will need the information to assist with your claim. Follow the phone prompts to be connected to the appropriate team to handle your balance billing situation. In addition, if you get a bill and you aren't sure if it is for more than what you owe, call. Customer care agents and advocates are here to help you and take away the worries of provider billing. Your ID card will be mailed to your home. It will look similar, but may differ slightly. You'll notice Quantum Health, HealthScope, Imagine Health, and Maxar are all on your ID card. This slide shows the medical biweekly rates for team members and their family. This slide shows the medical weekly rates for team members and their family. Westgate has partnered with OneDrop, a holistic diabetes self-care program to provide diabetes coaching, which will be separate from UMR coaching programs. Once enrolled, you will receive a smart glucose meter that wirelessly connects to the mobile app and an unlimited supply of strips and lancets delivered to your door. Through the OneDrop mobile app, you will receive one-on-one expert coaching, structured education and guidance. There is also a carbs and calorie counter with a food database and barcode scanner. As a member, you and your family will receive access to U.S. board certified physicians who can consult, diagnose, and prescribe medication if deemed appropriate via interactive audio or video. Regardless of the time and location, you can connect with a physician for common and acute illnesses. The physician will be able to review your telemedicine record, discuss symptoms and treatment options. Some of the benefits of a teledoc include 24/7, 365 access to a physician. Speak to a doctor at work, while you're traveling, or from the comfort of your own home. Save money by avoiding expensive ER and urgent care visits. Example of when to use a teledoc include: you are considering going to the ER or urgent care for a non-emergent issue. You're at work, home, or on a business trip. You do not want to sit in a waiting room with other patients. With Talkspace Online Therapy, you can now message a licensed therapist 24/7, safely and securely from your phone or desktop. No office visit is required. Simply register and choose a provider and message anywhere, anytime at Talkspace.com/connect. Talkspace is your space to use in your time. It's covered under your plan's behavioral health benefits. The EAP is available to team members and members of their household. You do not have to be enrolled in any of the benefit plans to take advantage of the EAP. EAP provides a variety of services that will support your work-life balance. It gives you referrals and information for family care, including, but not limited to, child, elder, and special needs care. Members of EAP are eligible for 6 free face-to-face licensed counseling sessions. You can also visit the Online Education and Resource Center to find information on topics ranging from healthy meal planning to parenting to getting organized and setting goals. Just about any topic you can think of related to behavioral health and well-being can be found in the EAP Online Resource Center. The Resilient Mind Plus Body program is available to all team members and can be applied immediately to your workday and provide education, motivation, and accountability. It's a 12-week program that progresses through practical mental and physical knowledge, skills, and tools for optimal well-being. You are not required to complete all 12 weeks. Simply choose the topic or topics that interest you. Watch and repeat as often as you like. Share this program with your family. Real Appeal is an online weight loss program available at no cost to eligible Westgate Resorts team members and families enrolled in UMR medical plans. When you enroll in this program, you are offered coaching support for a full year, a toolkit, a scale, exercise DVDs, food guide, and much more. Team members, spouses, and dependents 18 and older are eligible. To be eligible to participate, you must have a body mass index of 19 or higher. Get started by enrolling at mywestgatebenefits.com or the MyQ Health app from your smartphone, tablet, or personal computer. This slide shows the journey of the Real Appeal program with UMR. How much you pay and how long you wait may depend on where you go. Make sure you choose the right setting for your needs. Use Quantum Care Coordinators Monday through Friday. Call to get help choosing the right healthcare setting for illness or injury, or information about common health problems or injuries. Use Teledoc to request a consultation from a board-certified doctor any time of day, 7 days a week, by phone or online. Teledoc physicians can diagnose routine ailments, recommend treatments, and prescribe medications. Retail clinics, sometimes called convenient care clinics, are located in retail stores, supermarkets, and pharmacies. They offer routine care for colds and flu, vaccinations or screenings, sinus infections, minor sprains, burns or rashes, allergies, headaches or sore throats. Urgent care centers, sometimes called walk-in clinics, are often open in the evenings and on weekends. They offer timely care for sprains and strains, mild asthma attacks, sore throats, earaches, minor broken bones or cuts, minor infections or rashes. Visit your doctor's office for clinical care. Seeing your doctor is important. Your doctor knows your medical history and any ongoing health conditions. See your doctor for preventative services and vaccinations, medical problems or symptoms that are not an immediate or serious threat to your health or life. Visit the ER only if you are badly hurt. If you are not seriously ill or hurt, you could wait hours and your health plan may not cover non-emergency ER visits. Go to the ER for a sudden change in vision, sudden weakness or trouble talking, large open wounds, difficulty breathing, severe head injuries, heavy bleeding, spinal injuries, chest pain, major burns, major broken bones. Here are some tips to save money on emergency care. Emergency rooms are for serious conditions. Instead of going to the ER next time, take a few moments to consider an urgent care facility or a retail walk-in clinic located inside your pharmacy. It will save you time and money. Take time now to find an urgent care facility in your area so that you will know where to go the next time you need care. You can find online resources by visiting mywestgatebenefits.com. Look up providers. You will be able to see your claims and those of your dependents. You can print an explanation of benefits in case you have misplaced the one that you got in the mail. You can order a new ID card and also print a temporary one until the new one arrives in the mail. There are also health and wellness tools on the website to help you with weight loss, exercise programs, etc. Please be aware of the expanded list of preventative health services for women. You do not need to pay a deductible, copay, or co-insurance as long as you go in-network for the services listed. Please note that this is not a complete list. Refer to the flyer within PlanSource. Here is a sample of the UMR medical ID card if you are enrolled in the minimum, base, HPP, or PPO plans. Manifest RX. Find drug prices at all of your favorite pharmacies, including most drugstore chains, big box retailers, and your local mom and pop. Or if you're like most people are, choose free home delivery. You do not have to be enrolled in a Westgate medical plan to be eligible. Visit us today at westgate.manifestrx.com. To help manage the rising prescription drug costs, we have added a voluntary program for certain brand name maintenance medications. The program's name is WG Meds, offered through Canna RX, an international pharmacy program. Advantages of joining WG Meds are a $0 copay for all brand name prescriptions offered through the program, so no out-of-pocket expense. Prescriptions are shipped directly to your home with no shipping and handling costs. Please review the enrollment form, which includes the list of brand name maintenance medications. And by getting your prescription filled through WG Meds, you will have a $0 copay and receive a $50 gift card for your first prescription refill. This program is available for participants in the base, HPP, PPO, and HSP plans only. This does not replace your prescription coverage with UMR. Visit the website shown here for further details. Surplus's MXP Pharmacy offers a convenient, cost-effective way to order medications for home delivery. Medications obtained through mail order are limited to a 90-day supply. Once MXP Pharmacy has your prescription, refills can easily be obtained. You can ask your doctor for a new prescription written for up to a 90-day supply with refills up to 1 year. The doctor may fax, send electronically, call, or give you a written prescription to mail. For questions regarding your mail service program, call MXP Pharmacy. The MaxRemember portal and mobile app lets you sign up for mail order and new mail order prescriptions and refills, view and print your prescription history, update credit card information, manage dependents, locate pharmacies, and calculate your copays. You will need to create an account when you go to the member portal for the first time. You will need your member ID card to complete your registration. To create your portal account, follow the steps as outlined on this slide. Your plan includes My Maxer Link, a free way to receive helpful information about lower cost prescriptions on your phone. It's free and convenient. You can get helpful information about lower cost prescriptions sent securely to your phone. There is no app required. Look for this flyer in your enrollment packet. Have your member ID card ready? Then sign up by calling 888-596-0723 or go to mymaxerlink.com/maxerplus. Your prescription drug plan offers you the opportunity to reduce your out-of-pocket cost paid for specialty drugs. Westgate Resort offers a prescription drug plan through Paid Health. This plan provides additional support to members prescribed specialty drugs and products. Prior authorization and participation is required of those members prescribed specialty medication within the program. A Quantum Healthcare coordinator will reach out to you when and if appropriate to guide you through the program. Additional pharmacy options that can save you money are Costco and Walmart. Team members and their families enrolled in the base, HPP, PPO, and HealthScope plans should take advantage of Costco. You do not need to be a member. You simply show your UMR ID code and will pay nothing for generic medications, or $20 preferred, $40 non-preferred. As a reminder, under the base plan, you will still need to meet the prescription deductible, $300 for an individual, $600 for a family, prior to the benefit. Walmart offers a wide range of generics for $4 for a 30-day supply, or $10 for a 90-day supply. If you have a Sam's Club in your area, you can take advantage of their offerings as well. With a medical FSA, you are able to contribute up to $3,050 annually to pay for medical, dental, and vision expenses with pre-tax dollars. With the Dependent Care FSA this year, you can contribute up to $5,000 annually to pay for dependent care expenses with pre-tax dollars. This benefit is offered to full-time team members who have satisfied 1 year of employment and is effective in June of each year. Remember that FSA funds will not roll over to the next plan year. Be conservative in making your election for the 2023-2024 plan year. Any unused funds left in your healthcare or dependent care FSA at the close of your grace period, which is August 15th of 2024, are not refundable to you. The grace period means that you are given an additional 2.5 months to incur new expenses with prior plan year funds. At the end of the grace period, August 15th, all unspent funds must be forfeited according to the IRS. You will have 90 days after the plan year ends to submit dependent care claims that were incurred during the prior plan year. How much should you contribute? Add up all of the out-of-pocket expenses you had last year. This includes copays, deductibles, co-insurance, prescriptions, dental, vision, any child or elder care, and voluntary health policies not payroll deducted. This amount will help you estimate your out-of-pocket expenses for this plan year. You may contribute up to $3,050 for the healthcare FSA, $5,000 towards dependent care FSA. The dependent care expenses providing during a calendar year cannot exceed $5,000 a year for individuals or married couples filing jointly. This slide gives you an example of the savings when you contribute to an FSA, either by contributing to a health and dependent care FSA or just one or the other. What you contribute affects the amount of savings you will see. Again, you are urged to take precautionary steps when determining what you will contribute and track account balances on the Flex System website and or using the interactive voice response system to avoid having funds remaining in your account at the end of the plan year, because the FSA funds do not roll over. Here are some examples of eligible and ineligible expenses for health care under the FSA. The Coronavirus Aid, Relief, and Economic Security Act allows tax advantage plans like healthcare FSAs reimbursing 213D eligible medical expenses once again pay for or reimburse for over-the-counter drugs and medicines. These items no longer require a prescription or physician's note. This is subject to change with the response to COVID-19. Here are some examples of eligible and ineligible expenses for dependent care. You will receive the TASC Smart Card upon enrollment mailed to your home. It acts as a debit card and will come preloaded with the amount of your annual contribution for Healthcare FSA. The Task Card will also work for your Dependent Care FSA, but only with the available account balance. This will provide direct payment while at your provider when swiped from your FSA based on the balance of the card. Using the card eliminates out-of-pocket purchases and reimbursements for eligible healthcare expenses and eligible dependent care expenses. One additional card for dependent or spouse is available at no charge. Additional Task Card features: no claim forms to complete. The Task Card cannot be used for expenses incurred in the prior plan year. The Task Card does not expire for 4 years. Please make sure you keep your receipts if requested to substantiate. The My Task mobile app provides you with real-time account balances. You can also request a reimbursement. You can submit receipts using your device camera. You can view your plan information, contributions, and transactions. You can view your plan information, contributions, and transactions. With My Task text messaging, you can now request your account balance or a reimbursement. Transitions is here to help you throughout your career path, family path, and into your retirement path. Our dedicated advisors are ready to chat with you. Scan the QR code and learn more about transitions and their services. Are you Medicare eligible? How do you know? Asking yourself these questions may help you determine your eligibility. As a reminder, you can enroll any time of the year once you or your spouse are eligible for Medicare, regardless of your group benefit plan election options. It is important to understand what Medicare is. Medicare is the federal health insurance program for people 65 years or older, certain individuals under 65 with disabilities, or at any age diagnosed with end-stage renal disease. Medicare comes with several different coverage options. Plan A covers inpatient hospital services, skilled nursing, hospice care, and some home health care. Part B covers doctor visits, outpatient care, medical supplies, chemotherapy, preventive services. Part C covers all original Medicare services, plus sometimes extra benefits like gym memberships, dental coverage, vision coverage, and prescription plans. Part D, often included in a Medicare Advantage plan, covers Medicare-approved prescription drugs. Additionally, Medicare offers supplemental medical plan options. This additional coverage is offered by private insurers to help people pay for a portion of healthcare costs not covered by original Medicare, even deductibles and co-insurance payments. For more information, call 1-800-936-1405 or go to transitionsrbg.com. Transitions can assist you and your loved ones prepare for tomorrow by providing educational support, life stage and Social Security planning, Medicare coordination, COBRA alternatives, and more. Westgate Resorts offers 2 dental plans with Delta Dental. DHMO plan is available in Florida, Missouri, Nevada, New York, Tennessee, Texas, Utah, and Virginia. No deductibles, co-insurance, annual or lifetime limits. Includes 1 cleaning per 6-month period. This plan has a schedule of benefits with predetermined copays. The out-of-pocket costs are clearly defined. Must receive care from a Delta Care dentist. It's in-network only. Orthodontic coverage is available for children and adults. You must select a dentist during online enrollment. If you wish to change at any time, call customer service. The PPO plan is available nationwide. There are in- and out-of-network benefits, but staying in the network is the best value. Deductibles, co-insurance, and annual limits apply. It includes 2 cleanings in a 12-month period. You're able to stay with your current dentist, even if not participating, and still receive benefits out of network. Orthodontic coverage is available for dependent children to age 19 only. Dental implants are covered. Diagnostic and preventive max waivers, diagnostic and preventive dental services will not count toward your annual maximum. As previously stated, with this plan, you are responsible for copays when receiving services. There are no deductibles or co-insurance amounts. There is a schedule of covered benefits and copays associated with each service. As an example, depending on the type of crown needed, which would fall under major care, your copay will range between $195 and $355. You can find out what the cost will be prior to having any dental work done. You may refer to the DHMO schedule within the PlanSource library. The Dental HMO provides dental benefits through a network. It is important to understand that there is no out-of-network reimbursement. To receive the benefit from this plan, you must make sure that you visit a dentist who is in the plan. Please make sure there is an in-network dentist available in your area before enrolling in the DHMO. Again, this plan is not available in all areas. During your online enrollment, you will have access to the dental directory. You will need to choose a Delta Care DHMO dentist at the time of enrollment. If you do not select a dentist, one will be assigned to you based on your zip code. Additional information is available on how to look up a network provider within PlanSource. The DPO plan is available nationwide. You will notice that the benefit percentage is the same in and out of network. However, staying in network is the best value, as your percentage is based on the discounted rate. Whereas going out of network to a non-Delta dentist, they may balance bill you for the amounts not approved by Delta or over what Delta will pay. Deductibles do not apply for basic and major services, $75 per person or $225 per family. The coverage is 100% for preventative, which would be cleanings. Please make sure to take advantage of the 2 cleanings in a 12-month period with this plan. 80% for basic, which are fillings, extractions, endodontics, and periodontics, and 50% for major treatments, which would be crowns and dentures. There is a $1,500 annual limit per person per calendar year. If you are able to stay with your current dentist, even if not participating, and still receive benefits out of network, but be aware that the dentist could balance bill you. Orthodontia coverage is available for dependent children to age 19 only. Dental implants are also covered on this plan. Within the dental PPO or DPO plan, there are 2 different networks to choose from: in-network, or you can go out of network. In-network dentists have a contract with Delta, which provides reduced fees to members, no balance billing, and no claim forms. Delta also offers a unique secondary in-network group of providers, which is the Delta Premier Network. This network is larger than the dental PPO. 80% of dentists nationwide participate in this network. Or, members can visit out-of-network dentists, but they will be responsible for any fees beyond reasonable and customary charges and could be asked to pay the entire fee at the time of service. When viewing the online directory, you can specifically select in the system a list of PPO or Premier dentists, so you are able to see all your options. Here is a side-by-side comparison of the DHMO versus the DPO for your reference. This is also located in the Benefits Highlights booklet. As already communicated to you, and for your reference, here are the bi-weekly team member contributions. The premiums for dental have stayed the same this year. For your reference, here are the weekly contributions. VSP's vision plan is to assist you with vision care expenses by providing both an eye examination and materials, lenses and frames, or contact lenses. The VSP Vision Plan network is called Choice. VSP is affiliated with Costco Optical, Eye Care Centers of America, and other high-quality retail chains. To find a VSP doctor or retail chain affiliate, visit VSP.com or call 800-877-7195. The vision benefit gives you the freedom to select either an in or out-of-network provider and still have coverage. Although I recommend going in-network to receive the most from this coverage, you may receive 1 eye exam and 1 pair of prescription glasses or contacts every 12 months. The plan has copays and a maximum allowance for frames and contact lenses. This plan offers a select set of eye care services for members diagnosed with type 1 diabetes for an additional $20 copay. Westgate Resorts offers life and disability benefits through Mutual of Omaha to include employer-paid basic life and accidental death and dismemberment, voluntary life and accidental death and dismemberment, voluntary short-term disability, and employer-paid long-term disability. Westgate Resorts covers the cost of basic life and AD&D for both full-time hourly and salaried team members. Full-time team members will be automatically enrolled in the appropriate coverage level. You are required to designate a beneficiary online through PlanSource. This can be changed at any time. Voluntary employee life coverage is available in $10,000 increments up to the lesser of $500,000 or 7 times your annual earnings. This year, during open enrollment, an increase up to $30,000 annually for employee voluntary life will be allowed without an EOI. This is a great opportunity to increase your coverage without needing to complete an EOI. Spouse voluntary life coverage is available in $5,000 increments up to the lesser of 50% of the employee elected coverage up to $250,000. Child voluntary life coverage is available in 2 options, $5,000 or $10,000, regardless of the number of children. The employee must have selected at least $10,000. Life and AD&D coverage is offered together. Evidence of insurability, EOI, is required for new elections outside of initial new hire eligibility. Voluntary short-term disability. This plan replaces 60% of your pre-disability base salary up to a maximum weekly benefit of $2,000 should you become sick or experience a non-work-related injury. Benefits begin on the 15th day of accident or illness. Maternity coverage is included. Benefits can continue up to a maximum of 24 weeks. Keep in mind, there is a 3-month look-back period from the time you elect coverage. That means, for example, if you are currently being treated for a medical condition, you can choose short-term disability during this open enrollment. This condition will not be covered, though, for 6 months. Evidence of insurability is not required during the open enrollment for new elections, but is required at any other time. Long-term disability protects your loss of pay when you are sick or injured and unable to work, non-job related. You are automatically enrolled if you are enrolled in one of the medical plans through Westgate. Your benefit is equivalent to 60% of before-tax monthly earnings not to exceed $10,000 monthly. A 3-month look-back means if you have been treated for any medical condition 3 months prior to coverage, that medical condition will not be covered for 12 months. This would not apply if you have elected voluntary short-term disability. There will be a 180-day elimination or waiting period before receiving this benefit. The transition from voluntary short-term to long-term disability benefits will be coordinated through Mutual of Omaha and your doctor's office. Included in your benefit for all team members is Mutual of Omaha's will preparation services. Creating a will is an important investment in your future. It specifies how you want your possessions to be distributed after you die. Epic offers a secure account space that allows you to prepare a will and other legal documents such as power of attorney, healthcare directives, and living trusts. Simply log on to willprepservices.com and use the code MUTUALWILLS to register. Mutual also provides discounts on hearing programs through Amplifon. Accessing your benefits is easy. Simply call 888-534-1747 and a patient advocate will assist you in finding a hearing care provider and answer any questions you may have. You may also learn more by visiting amplifonusa.com/Mutual of Omaha. The Voluntary Accident Insurance Plan is offered from Voya. The purpose of this policy is to cover off-the-job accidents and injuries. There is a listing of specific accidents and injuries that are not covered and what the benefit amount will be for that specific injury or accident. The accident insurance pays directly to you regardless of other insurance that you may have, such as medical, auto, or short-term disability. Also, you do not need to be enrolled in UMR's medical plan. It is available to you and your family. It's important to note that the wellness rider that is part of this plan, which will pay directly to you $150 when certain wellness tests are performed. What this means is that you and your covered spouse can receive a benefit of $150 for certain wellness-related tests. For example, when you have routine physicals, mammograms, or a colonoscopy, among other tests that are listed in the accident insurance brochure, you and your covered spouse can each receive the $150 benefit. No evidence of insurability is required if electing past your initial eligibility. The benefit resets each calendar year. The wellness benefit encourages wellness-related tests and rewards those employees that take the time to get those tests done. You will receive a packet of information once enrolled that will explain how to file a claim. Westgate is offering new enhancements to Voya's accident plan, including increased benefits to emergency room treatment, hospitalization, and ambulance services. This is the schedule of benefits for specific fractures and dislocations and the flat dollar amount Voya will pay to you after an accident. An open reduction means the wound would require surgery. A closed reduction means the wound would not require any surgery. The voluntary critical illness plan from Voya pays a lump sum benefit if you are diagnosed with a covered illness or condition. Critical illness insurance is a limited benefit policy. It is not health insurance. Features of critical illness insurance include: no medical questions or tests are required for coverage. It is a guaranteed issue. You can use the benefit money for any purpose you would like. Premiums are paid through convenient payroll deductions. This plan also pays out an annual wellness benefit if you complete a health screening test. You may only receive a benefit once per year, even if you complete multiple health screening tests. Examples of health screening tests are PEP tests, serum cholesterol tests for HDL and LDL levels, mammography, colonoscopy, and stress tests on a bicycle or treadmill. The annual benefit is $50 for completing a health screening test. If your spouse and or children are covered by the critical illness insurance, they are also covered by the wellness benefit. Your spouse's benefit is also $50. The benefit for child coverage is 50% of your coverage with an annual maximum of $100 for children's benefits. Critical illness insurance can help you when you are diagnosed with one of the covered illnesses or conditions listed here. Some examples would be medical expenses such as deductibles and copays, child care, home health care costs, mortgage payment, rent, and home maintenance. Premiums are based on your age and tobacco status and can be viewed when enrolling online in PlanSource. Further details are also included in the benefit highlights and summary plan description and in the PlanSource library. Here are the rates for voluntary critical illness coverage. The voluntary hospital indemnity plan from Voya can help you pay any expenses for a hospital stay that are not covered by your medical insurance, such as your deductible or coinsurance. You can choose from 2 different plans with different coverage levels to best meet your needs. Features of Hospital Indemnity High plan include no pre-existing condition limitations, and no age reductions. You can use the benefit money as you see fit, for example, to help copays, deductibles, and coinsurance costs due to hospitalization or lost time from work. Premiums are paid through convenient payroll deductions. This plan also pays an annual wellness benefit if you complete a health screening test. You may only receive a benefit once per year, even if you complete multiple health screening tests. Examples of health screening tests are pap tests, serum cholesterol test for HDL and LDL levels, mammography, colonoscopy, and stress tests on a bicycle or treadmill. The annual benefit is $50 for completing a health screening test. If your spouse and/or children are covered for critical illness insurance, they are also covered by the wellness benefit. Your spouse's benefit is also $50. The benefit for child coverage is $25, with an annual maximum of $100 for children's benefits. Features of the Hospital Indemnity Low Plan include no pre-existing condition limitations and no age reductions. You can use the benefit money as you see fit, for example, to help with copays, deductible and coinsurance costs due to the hospitalization or lost time from work. Premiums are paid through convenient payroll deductions. With the ASPCA Pet Health Insurance Program, you can choose the care you want when your pet is hurt or sick and take comfort in knowing that they have coverage. ASPCA offers customizable options for pet owners. Just pay your vet bill, submit claims, and get reimbursed for covered expenses. You're free to visit any licensed vet, specialist, or emergency clinic you want, and you can choose to receive reimbursement by direct deposit or mail. Click on the link to get a free quote, and be sure to use the Westgate priority code for additional discounts. You can add one of our preventative care coverage options for a little more each month. Each one has a list of covered services, and each service has a set maximum annual benefit amount. There's no deductible or coinsurance amount. These benefits are available as soon as your plan is effective. Things like vaccine, flea heartworm prevention, and dental cleanings can help keep your pet from getting sick. Other services like regular checkups and wellness screening let your veterinarian detect health problems in the early stages, which can mean a better outcome for your pet. If you're already paying for your pet's preventative care, why not get cash back for it? Next, we'll take a look at the MetLife Legal Plan. You and your dependents have access to legal assistance for some of the most frequently needed personal legal matters, with no waiting periods, no deductibles, and no claim forms, when using a network attorney for a covered matter. You can choose from one of our network of pre-qualified attorneys, or use an attorney outside of our network, realizing you will be reimbursed some of the cost. Here is a chart to give you an idea of all that MetLife can offer in helping you navigate life's planned and unplanned events. It's easy to access MetLife Legal. You can access MetLife Legal plans by calling 800-821-6400 or by visiting the website at members.legalplans.com, and a client service representative will help you find a network attorney in your area. Or if you have a quick question for an attorney, you can send questions directly to our attorney e-panel and get a response within 48 hours. While you can't predict life outcomes, you can help prepare for them with digital estate planning, MetLife's online estate planning solution. With digital estate planning, we make it easier than ever to create estate planning documents all online by answering only a few simple questions from the comfort of your home. MetLife's digital estate planning solution is available to employees and their legally married spouse when the employee is enrolled in Basic Life, Supplemental Optional Term Life, Group Universal Life, and/or Group Variable Universal Life insurance coverage. If an employee is eligible for MetLife's digital estate planning, they are still able to work with an attorney face-to-face for their estate planning needs. To access the online estate planning documents or locate an attorney for a face-to-face meeting, an individual just needs to visit legalplans.com/estate planning and follow the online instructions. Individuals that are not eligible for our online digital estate planning or face-to-face will preparation services can still have estate planning documents created by visiting willscenter.com. Here's a real-life example of how the legal plan helped an employee juggling caring for her growing family and her aging parents. An employee who enrolled in the legal plan was able to save a substantial amount of money on will prep and document review, as well as get help for her father through our legal plan. She was glad that she had expert legal guidance to give her peace of mind for her child's future. As you are aware, online enrollment is done by accessing PlanSource. All passwords have been reset for open enrollment. To review briefly, you will log in to benefits.plansource.com. Your user ID will be a combination of the letters WG and your 5-digit employee number, for example, WG00234. Passwords have been reset to your date of birth in the following format: a 4-digit year, 2-digit month, 2-digit day. Once you log in with this default password, you will be prompted to create a new password. It is important to point out that you should verify all data is accurate when accessing the system: name, address, dependents, dates of birth, Social Security number, and current plan elections. Click on Get Started to begin and shop for your benefits. The system will require you to add or include beneficiaries in order to proceed. You must click the Checkout button at the bottom of the enrollment page in order to lock in your elections. Otherwise, your updates will not be applied. Benefit plan and life event information are located in the Documents section, including this presentation, the Open Enrollment Memo, and the benefits highlights and summary plan description along with the required notices, all of which can be accessed at any time, not only during your annual open enrollment. Important reminders. If you are covering a spouse, you will need to log into PlanSource to answer the spousal surcharge question about your spouse's alternative medical insurance coverage, even if you have answered this question last year and nothing has changed. It is critical to ensure that your beneficiaries are always up to date. Now you are ready to enroll. Go online to review all data: name, address, dependents, dates of birth, Social Security number, and current plan elections. Review further detailed benefit summaries and new deductions that apply to you. Determine if you need to make changes. All changes must be updated in ADP. If you wish to add, drop, or change coverage, you must do so by going online no later than Thursday at 11:59 p.m., May 11th, 2023. This concludes the presentation for open enrollment. Any questions can be emailed to benefits@wgresorts.com. Thank you for your time.